Hello, my name is Peter Melamed, PhD. I'm a holistic practitioner of the Biotherapy Clinic in San Francisco. So today the topic in our conversation will be pancreas. Why I so brave to talk about pancreas? Because I have 40 years of experience working, especially in my country, like medical doctor in intensive care, acute intensive care unit, and psych intensive care unit with people who have acute pancreatitis. So I save many lives people with acute pancreatitis in my country. Later, I was the chief doctor in the diagnostic department, so I saw a lot of people with mild pancreatitis and problem with pancreas. And here in the United States, after passing all exam, I am a holistic practitioner of the Biotherapy Clinic. So I saw a lot of people with pancreatic problems, and they help many all over the world. Today we will talk about mystery or puzzles of the pancreas. The pancreas, number one, if I ask my patient, where is your pancreas located, they usually give me this and this and this. So yes, this is a small gland, and they're hidden in the inside of the abdominal cavity. So this is close to this, and they covered by it first in the stomach and surrounding the stomach, the duodenum, spleen, aorta, and small intestine. But this small gland have a very important for our, is really important for our body. We don't have too much attention even on the internet about the pancreas. Why? Because a few reasons for it. The pancreas, what people know about pancreas? The people know about pancreas because it's diabetes connected to pancreas and the pancreatic cancer. We know the Steve Jobs that died from pancreatic cancer, so this is make the people attention to this organ. People don't pay attention too much to the pancreatic gland. Why? We live in pharmaceutical and surgical world, in high tech of the test of medicine. So for now we don't have a real simple test who can find the beginning of the problem with pancreas. We don't have real pharmaceutical medicine to improve the function of the pancreas. So if you don't have a pharmaceutical, we don't have medicine, we don't have diseases. So that's why the attention to the pancreas is so low. But the pancreas is a very important organ for us. Let make me gastroenterology, digestive system simple. What we have a tube from mouth to anus, and this tube will have something, the cavity, like mouth, stomach, small intestine, large intestine, and when the digestion occur. But they have also the gland, the salivary gland, the pancreas, and the liver. And without this gland, the pancreas, especially pancreas and liver, who produce the bile, we cannot have a digestion. So this will be tube. The people eat the food, but the food not digested properly. Not properly digested, not properly eliminated, not properly go to our system. So this is very important organ, like digestive system. And if something happened there, the body cannot get the vital nutrients, so we have a lot of problem with well-being. What happens if the pancreas doesn't manufacture the very important thing like digestive enzymes? The food what we eat won't be digested, so they collect it in the small intestine, large intestine, and will be fermented and rotten, and they make a lot of toxin, and the body want to get rid of it. So they have only two ways, by mouth and in the large intestine. So the people, when they not digested properly food, when they wait to go out, they have what, heartburn, burping, the nausea, vomiting, different kind of things. If you go down, you have a constipation, diarrhea, something if your pancreas doesn't work properly. You look around, ask some people, even 50% of Americans have a problem with digestive system. What we have, mostly the people have the gas, bloating, cramping, nauseous, vomiting, diarrhea, constipation, something like this. But the very important thing, what we have to know, the pancreatic enzymes, they're responsible not only for digestion, they're responsible for well-being, better well-being, immune system, energy, immunity, and even they have anti-cancer property. Pancreas doesn't manufacture pancreatic enzymes, so we have a few problems. We don't have enough nutrients to go to our system, so we sort of starvation with the abundance of the food. So we have a lot of deficiency of vital nutrients. So this will be a lot of symptoms very far from gastrointestinal tract. And another way, if you don't digest properly food, we have deficiency of the vital nutrients like minerals, proteins, minerals, trace elements, and this is part of our pancreas. So the pancreas doesn't work properly by itself. This is a vicious circle occur. So the very important for us to have the normal functioning of the pancreas. The people ask, oh, that is a very rarely diseases, and you can hear it. Oh, pancreas, it's very rarely diseases. No, it's not rarely. Let's see some statistic. So we have it in 2017, 83,500 people died from complication of diabetes. What's the diabetes? This is the diseases of the pancreas. In 2017, 44,000 people died from pancreatic cancer. What it is? This is a problem with pancreas. By statistic, 87% of cases of pancreatitis annually occur in the United States. This is the only tip of the iceberg. Because this is in many situations we have a mild pancreatitis. So if you don't have the real test who can really discover this is a problem with the pancreas, so we have to focus on the symptoms. So I repeat again and again, the whole problem with symptoms with gastrointestinal tract, some symptoms of indigestion, again, heartburn, nausea, vomiting, good appetite, bad appetite, cramps, pain, diarrhea, constipation, everything, it can be connected to the pancreatic gland. More, we have scientific evidence for some diseases or problems like GERD, gastroesophageal reflux diseases, or dyspepsia, or irritable bowel syndrome. They really connected with low function of the pancreas. And many people knows what is a fatty liver. So in the United States, maybe 25%, 1/4 or maybe 1/3 people suffer from fatty liver. And the fatty liver usually not alone. This usually involved in the fatty pancreas. So if this organ, they have a fatty deposit in this organ, they suffer from low functioning. So that's why the people have a lot of digestive symptoms. Next, what very important thing, if we cannot diagnose the pancreatic disorder in the early stage, so the people suffer from chronic pancreatitis. Let's look in any textbook for medical doctors. Describing of the chronic pancreatitis start from clinical picture, like, you know, the constant pain, abdominal pain, mostly to the left side of upper abdomen. They have the oily stool because the people cannot digest properly fat, so oily, full smelling the stool, the lose weight, fatigue, and this is the symptoms, if not the symptoms of the like it's called pancreatic insufficiency. I use the expression pancreatic deficiency. So the Mother Nature very smart in the put the functional capacity of the pancreatic gland 90%. What does it mean? It means the human being can survive if one half of the lung will be destroyed by surgery or by diseases. People can survive if the two-thirds of the liver will be not functioning. People can survive if 75% the kidney functioning will be destroyed, or they can survive. And people can survive if the 90% of the pancreas functional capacity will be destroyed. So what does it mean? The Mother Nature will give the pancreas the more capacity to survive. So when we have the chronic pancreatitis, and when we have the oily stool, fatigue, constant pain, indigestion, and the diarrhea, so this is in 10% of functional capacity of the pancreas left. So attention of the people need to be for beginning of the problem. Beginning of the problem can be from acute pancreatitis. So what happened? The people have acute pancreatitis. It can be mild, so some pain or something, symptoms of the pain, nausea, vomiting, diarrhea, and can be in this acute pancreatitis, in the mild. If the pancreatitis will be severe, the people running to the emergency room. So acute pancreatitis is not such a simple thing. So in severe cases, maybe 20–30% died from these diseases. If the people lucky and survive after acute pancreatitis, so after discharging from hospital, they have, okay, don't drink, don't eat fatty food and spicy food. This is not only can save their life. So to my experience, many years of experience, I couldn't see the self-healing of the pancreas. So later on I will explain you what the reason for pancreatic diseases and what we can do. For all my life I try to develop the system or methods or program how to postpone the pancreatic deficiency, what it's called, or we can call it pancreatic failure, like, you know, the lung failure, kidney failure, liver failure. It have a failure of the pancreatic gland. So what it's called really like chronic pancreatitis. We need to avoid as maximum, postpone this situation. We need to focus on the early stage of the pancreatic diseases. In Biotherapy Clinic of San Francisco, we developed different kind of method of treatment or problem with digestive tract, and we will call it pancreatic problems. So we use different kind of approach what many doctors or medical practitioners use all over the world. Some of them have thousands of years of using, some of them they're very sophisticated. So this program can help people to survive, especially for beginning of the pancreatitis. So if you want to know more, you can search in the internet my name Peter Melamed, PhD, and pancreatitis. You will find a lot of information about this topic. So you can find our book. It's called Healthy Pancreas, Healthy You. You can find the medical articles, scientific medical articles, and a lot of the popular articles about this subject. Our telephone number is 415-409-3939, so you can go and take the consultation by phone also. So thank you for watching and have a good health.